Some great ideas spread fast. Take anesthesia, for example. It took less than a year from when the first report on anesthesia was published in 1846 until it spread to most of the world. Sure, some ideas spread like wildfire, but most don't, no matter how compelling or evidence-based they are. For example, there are lots of proven ways to save mothers and babies from dying, but so many people don't use them. It takes some work and a bit of skill to make sure great ideas and proven practices are actually used. At FHI 360, we have a team of people who know how to get good ideas out there. Our research utilization team works to accelerate the application of evidence in global development policies and programs. We do this through a process that is deliberate, planned, and managed. The need for a deliberate process is well documented. There needs to be a bridge to get from evidence to impact. That is where research utilization comes in. The reality is that there is a huge gap between what we know and what we do. In fact, the time between discovery and impact in health and development programs can be over a decade. At FHI 360, our tagline is the science of improving lives, and our research utilization team helps do that by putting good evidence to work. You see, our strategies are evidence-based themselves. We work hand in hand with researchers, decision makers, and program implementers to approach research utilization from 3 directions: supply, demand, and use. It's important to prepare for the future use of evidence before the research is designed. We help during the planning phase to make sure the research is locally relevant, practical, and meets the need of those who will use it. We help motivate decision makers to seek out evidence, and we help people use evidence to affect change in the form of better policies, more effective programs, and the scale-up of high-impact practices. Because finding out what works and what doesn't is not enough. We cannot assume that simply publishing the results make a difference, that programs change immediately based on good evidence, that projects are necessarily designed based on the evidence for what works.
I want to make sure my intervention is relevant to the people who are going to use it.
Our team of research utilization experts helps find out exactly what information will help stakeholders respond directly to policy and program needs.
What if my intervention works so well that people want to scale it up?
We have helped many countries scale up practices through advocacy, updating service delivery guidelines, developing curricular and training programs, and much more.
Could my research really lead to policy change?
Yes, but not on its own. Let's look at an example from the family planning world. 8 years ago, a few individuals in Uganda decided to try using community health workers to provide injectable contraception to women who wanted it. This worked in Asia and Latin America, but many people were skeptical about doing it in Africa. Today, more than 11 countries have taken up the practice, but it didn't happen spontaneously. It wasn't enough to simply publish the evidence that community health workers could safely and effectively administer injectable contraception. Global, country, and local level advocacy, stakeholder engagement, effective packaging and communication of research findings, development of programmatic guidance, and work with high-level champions were all needed to expand this practice across the continent. At FHI 360, we have seen that a dedicated research utilization strategy can lead to great results. Our staff are building bridges across communities and continents to ensure that development policies and programs are evidence-based in order to have maximum impact.
For more information on research utilization at FHI 360, visit us online. Or email us. We'd love to hear from you.